How to become a medical coder. Step 1. Choosing an organization. Who will you get certified by? AAPC and AHIMA are the most recognized in the industry. The AAPC was founded in 1988. It provides education, professional certification, networking and employment opportunities to medical coders. Supports coders working in a variety of settings, including inpatient hospitals and facilities, regulatory compliance, and physician practice management. Has a membership base of over 155,000 worldwide. 108,000 of those members are certified. AHIMA, renowned worldwide Association of Health Information Management, (HIM) professionals, since 1928. Serves 52 affiliated state associations and more than 101,000 health information professionals. Known for rigorous professional education and training. Leader in the industry for guiding the management of health data and medical records that allows healthcare providers to effectively deliver quality healthcare to the public. Step 2. Which medical coding certification is right for you? The following symbols have been added to this presentation to provide a better understanding of the specialties of coding for each certification. Symbol 1 represents physician coding, Symbol 2 represents outpatient hospital and facility coding, and Symbol 3 represents inpatient coding. Certified Professional Coder, CPC. Provides medical coding in doctors' offices and other locations that require coding for physicians. Maintain compliance and profitability within medical practices through accurate medical coding and documentation. There are over 108,000 certified professional coder, CPC. Reviews and assigns medical code for procedures, diagnoses and services performed by healthcare providers. Shows proficiency across a range of services, such as evaluation and management, anesthesia, surgery, radiology, pathology, and medicine. Understanding of medical terminology in order to accurately code diagnosis and medical services. Knowledge of current medical coding regulations and guidelines. Certified Professional Coder, CPC, exam, shows proficiency in all code sets, CPT, ICD-10-CM, HCPCS Level 2. Documentation guidelines. Evaluation and management principles. The CPC exam has 150 multiple-choice questions, proctored. 5 hours and 40 minutes maximum time to finish exam. Includes one free retake. The cost of the exam is $350, $290 for AAPC students and Learn Medical Coding students. Open codebook, manuals, during test. Certified Outpatient Coding, COC. Formerly CPCH. Assigns codes for diagnoses, procedures and services performed in the outpatient setting. Outpatient services include outpatient clinics, ER visits, same-day surgeries, radiology and laboratory diagnostic testing, and outpatient therapies, such as physical therapy or occupational therapy. Proven proficiency across a wide range of services, including evaluation and management, anesthesia, surgical services, radiology, pathology, and medicine. Currently, this specialty is seeing a rise in job opportunities due to changing medical practice settings that will likely grow. More doctors are now choosing hospital groups over private practice, resulting in a shift toward outpatient facilities. Certified Outpatient Coding, COC, exam. 150 multiple-choice questions. 5 hours and 40 minutes maximum to finish. One free test retake. Cost of exam is $350, $290 for AAPC students and Learn Medical Coding LLC. Open codebook, manuals, during the exam. Certified Inpatient Coder, CIC, the new Inpatient Medical Coding Certification Standard, the only certification solely dedicated to inpatient hospital and facility coding, shows expert-level knowledge and experience in abstracting information from the medical record for ICD-10-CM and ICD-10 PCS specific coding, and specialized payment knowledge in MSDRGs and inpatient prospective payment systems, IPPS. Certified inpatient coders earn 40% more than non-credentialed coders. Certified inpatient coders, CIC, demonstrate superior capability in reviewing medical records to glean the information necessary for accurate inpatient coding. Ability to accurately assign ICD-10 medical codes for diagnoses and procedures performed in the inpatient setting. Up-to-date knowledge of the rules and regulations in regards to medical, complete reimbursement. Skilled proficiency to coding and reimbursement rule changes in a timely manner. Proficient understanding of anatomy, physiology, and medical terminology necessary to accurately code for diagnosis and services. 60 multiple choice questions and 10 inpatient cases. Fill in the blank. 5 hours and 40 minutes to finish the exam. 1 free test retake. $350, $290 for AAPC students and Learn Medical Coding students. Open codebook, manuals, during exam. The exam consists of questions regarding the correct application of procedures and diagnosis codes used specifically for inpatient hospital facility services. AHIMA Certifications, CCS, Certified Coding Specialist, CCA, Certified Coding Associate, CCS P, Certified Coding Specialist Physician-based. The CCS, CCA, CCS P are the only accredited programs recognized by the National Commission for Certifying Agencies, NCCA. Certified Coding Associate, CCA. The CCA credential demonstrates commitments and coding competencies across all settings, including both hospitals and physicians' practices. The U.S. Bureau of Labor Statistics estimates a high demand for CCAs. They previously predicted a shortage of more than 50,000 qualified HIM and HIT workers by 2015. Being a CCA positions you as a leader in an exciting and growing market. Through certification, CCAs prove a high level of professional competency, accuracy and capability that employers want. CCAs stand out from both coders that are not certified and from coders holding certifications from less rigorous organizations than earned through AHIMA certification. Let's compare the CCA with other AHIMA coding credentials. The CCA proves coding multi-setting competency and can work in both hospitals and doctors' practices. The CCS and CCSP certifications are specialty-based. CCSs specialize in hospital settings and CCSPs focus specifically on physician-based practices. Eligibility to become a CCA, high school diploma or equivalent required, recommended, though not required, 6 months coding experience directly applying codes, completion of an AHIMA-approved coding program, completion of other coding training program that includes anatomy and physiology, medical terminology, basic ICD diagnostic procedural and basic CPT coding. Exam specifications, 2-hour, 100 multiple choice item examination consisting of 90 scored items and 10 pre-test items. Candidates' scores are based solely upon the number of scored items on the exam. Pre-test items do not affect the candidate's score. Pre-test questions are administered to evaluate the item's difficulty level for possible inclusion as a scored question in future exams. These pre-test questions are dispersed throughout the exam and cannot be identified by the candidate. Certified Coding Specialist, CCS. CCSs classify medical data from patient records, generally in a hospital setting. These coding specialists review patients' records and assign numeric codes for each diagnosis and procedure, possess expertise in the ICD-10 CM and CPT coding systems, understand medical terminology, disease processes, and pharmacology. Where certified coding specialists' work is used for reimbursement from medical facilities and providers, through insurance and government programs, and also for public health researchers and officials to understand health patterns of the general public. CCS credential demonstrates a practitioner's tested data quality and integrity skills, and mastery of coding proficiency. Advanced certification for professionals experienced in patient and outpatient records coders. Certified Coding Specialist Eligibility. To become a Certified Coding Specialist, CCS, you must meet at least one of these requirements. By completing a medical coding training program with specific courses including medical terminology, anatomy and physiology, pharmacology, reimbursement methodology, intermediate advanced ICD diagnostic procedural and CPT coding. Or have one of these three credentials: CCS P, RHIT, or HIA. Have at least 2 years of direct coding experience. Have earned a CCA certification and 1 year experience coding, or earned a coding credential from another organization with 1 year direct coding experience. Exam specifications. Multiple choice section. The multiple choice section will consist of 97 single response multiple choice items, 79 scored, and 18 pretest items. Pretest items are unscored items that are included in the examination to assess the item's performance prior to using it for operational use in a future examination. The pretest items are scrambled randomly throughout the examination and do not count toward the candidate's score. Medical scenarios. The medical scenarios will consist of 8 scenarios, 6 scored/2 pretest. Each scenario will have up to 3 separate questions. They will require candidates to pick from a range of codes to answer each question. The total testing time for the exams is 4 hours. Certified Coding Specialist Physician-Based, CCSP. CCSPs are coding professionals who work specifically in physician-based settings such as doctors' offices, group practices, and clinics with 1 or more specialties, thoroughly review patient records and assign numeric codes for each diagnosis and procedure, have an in-depth knowledge of the CPT coding system and familiarity with the ICD-10 CM and HCPCS Level 2 coding systems, are highly skilled in health information documenting and quality data integrity. Certified Coding Specialist Physician-Based Job Outlook shows high demand for this specialty. Increases in job openings are a result of growth of managed care and the trend toward increased services delivery outside of hospitals, doctor's office, clinics, etc. CCSP certification proves master-level coding skills. To become a certified coding specialist physician-based, CCSP, you must meet at least one of these requirements. By completing a medical coding training program with specific courses including medical terminology, anatomy and physiology, pharmacology, reimbursement methodology, intermediate advanced ICD diagnostic procedural and CPT coding. Or have one of these 3 credentials: Certified Coding Specialist, CCS, Registered Health Information Technician, RHIT, Registered Health Information Administration, RHIA. Have at least 2 years of direct medical coding experience. Have earned a CCA certification and 1 year experience coding, or earned a medical coding credential from another organization with 1 year direct coding experience. Exam specifications. Multiple choice section. The multiple choice section will consist of 88 single response multiple choice items, 70 scored, and 18 pre-test items. Pre-test items are unscored items that are included in the examination to assess the item's performance prior to using it for operational use in a future examination. The pre-test items are scrambled randomly throughout the examination and do not count toward the candidate's score. Multiple select section. The multiple select section will consist of 8 multiple response items, 6 scored, and 2 pre-test items. Pre-test items are unscored items. Fill in the blank section, medical record cases. The fill in the blank section will consist of 13 medical record cases, which requires you to perform diagnostic, ICD-10-CM, and procedural, CPT and HCPCS Level 2, for physician services. The total testing time for the exams is 4 hours. Most of our programs were created by the AAPC and are approved by AHIMA. We offer thorough, affordable, quality education, everything you need to prepare you for your new medical coding career. For more questions about which certification is the right fit for you. Medical coders play an integral role in the healthcare industry. Skilled, knowledgeable practitioners are in demand right now. Employers know the certified ability to competently code is important to healthcare organizations for both its impact on financial revenues and keeping accurate records. Being certified has become an industry standard that employers want and expect. You can choose from a variety of specialties and settings to work in. Sign up today to get your certification and get ahead in this in-demand profession.